Hello, everybody. My name is Willie Martinez, CEO of KLM Healthcare. I've been a licensed insurance agent for about 20 years, but got started in 1977 with home-based business and network marketing. And it was in the 90s where I learned the secrets of building teams. And I've built teams with over 70,000 reps and over 200,000 paying customers. Now I do still sell major medical health insurance because I'm still licensed, but we're going to be talking about association plans where you can create a fortune because of what's happening with healthcare reform. So let's get started. Our association healthcare program is one of the three types of healthcare programs used today in our healthcare system. So let's get started with government Medicare. People work jobs, whether you have your own business or not, pay income taxes, Medicare and Social Security taxes. When you retire, become eligible for Medicare. Medicare is major insurance subsidized by the government. You'll have co-pays for doctor visits, co-pays for prescriptions, and you have 80% covered for your hospital bills. And that's why of all the millions of Americans on Medicare, about 99% probably purchase some kind of Medicare supplement plan called Medigaps at an additional cost per month so they can cover those, little holes not covered by that 80%. Now, private health insurance, the second type of healthcare programs used in the country, can get pretty expensive. And even if you get it to a job, it gets expensive. And if you buy it by yourself, it's really expensive. Now, just like Medicare, major medical health insurance will have co-pays for doctor visits and prescriptions and deductibles. And the most common type, even not all of them are like this, but the most common type of major medical will have an 80-20 co-insurance or 80% coverage for hospital bills. Similar to Medicare, a little bit different, but very close. And that's why there are tons of companies out here. I mean, lots of companies that sell little supplement plans, just like Medicare. People can buy supplement. People can purchase from different insurance carriers supplemental type plans to cover those gaps. And that's where we come in. And the third type is association healthcare benefits. And what we've done, just like Sam's Club and Costco and AARP, is we have an association people can join for $12 a year for an entire family. Once they become a member of our association, again, just like AARP and Sam's Club, the membership to the association, of course, doesn't have any insurance benefits yet. That's why you don't need a license to market the association memberships because there's no insurance benefits in the beginning. But once they join it, they now become available and eligible for our group benefits. And so we have association plans that include limited type supplemental benefits for health, life, and dental. And we're going to talk about that. Now, health insurance rates are going up all over the country. You can see it in all kinds of articles. And in California, it became the first state to release the prices on the federal exchange plans coming out in October. And Obamacare is stated to increase individual health insurance premiums by 64 to 146% so far in California. So some articles out there that you can read about. Now, the benefit mandates, the law became actually in 2010, the law was passed for the Affordable Care Act. In June of 2012, the United States Supreme Court upheld the individual mandate. And so in January 2014, it becomes effective. There are a lot of pages, over 1,000 pages. This is just the basics. One of those is that the new major medical plans, for you to comply, cannot have a deductible higher than $2,000 a year for an individual, $4,000 for a family, and that's not including your co-insurance, which then would increase it to over $12,000 a year out of pocket for a family. So that's a lot of money. But what happens if individuals don't want to purchase health insurance? They're going to have to pay a tax penalty that will be collected by the IRS on your tax form starting in 2015. The first year of implementation in 2014, the penalty is going to be either $95 per adult per year or 1% of your income, whichever is greater. So $30,000 to $40,000 a year salary, which is not a lot of money. 1% of that is $300 to $400 per adult penalty, $47.50 per child. So so it can be a lot more than just that $95. In 2016, if you still don't have health insurance, the fine increases to $695 per adult, $347.50 per child, up to $2,085 per family per year, or 2.5% of your income, whichever is greater. Now, does the employer have to keep providing health insurance? For companies with 50 or more full-time equivalent employee, what does that mean? That means if a company has over 100 part-timers working less than 30 hours a week, under the new healthcare laws, every 2 part-timers will count as 1 full-timer. So they still can't get away with that. If they don't, then the employer faces a $2,000 fine per year per full-time employee, after the first 30 full-time employees, so no penalties in the first 30, if health insurance is not provided to at least 95% of all full-time employees. It's a lot more. This is just the basics. Now, there's a solution, and this is not new. For many years, people have access to high deductible health insurance plans, and all the major medicals sell them. And even the federal exchange plans will be modeled after this, by the way. It's a great option. It's a healthcare plan that charges a lower premium, so it costs less, but it has a higher deductible. And it does qualify for Obamacare as long as you don't exceed those deductibles. Small business owners find that a high deductible health plan is a great way to provide health insurance, and it is major medical insurance to their employees, so it covers them if they have a heart attack, stroke, and they want to have babies, whatever. Now, here's an example of what we can do. I'm still licensed. This is a quote I did about a year ago for a 53-year-old man with a quote from Blue Cross Blue Shield, major medical with a low deductible, okay? Co-pays and everything, but look at the cost. At healthy, about 713. If they're overweight and have even just a few medications, that jumps up to close to $900 a month, 892. But look at option two. I raised the deductible, and now look at the monthly premiums, a lot less. So that's a savings of $416 to $521 a month, and still would have major medical, still compliance with Obamacare, and the great idea for businesses as well for their employees. That's just one example. Now, what we have to do is provide, just like Medicare, a gap, and that's where we come in with our association plans. We have many association plans. This is just one of them. I don't want to try and put 40 different plans in front of you. This is one of the smallest ones we have, and it only has hospital insurance benefits to cover the gap. We have other plans that have a lot more benefits for labs and x-rays and all kinds of stuff. But this one's only $84 a month for a single person. It covers $1,000 per day in a hospital, any hospital for any reason, $2,000 per day for intensive care and critical care. That's up to 31 days a year, more than enough money to cover your deductibles and co-insurance if you purchase a major medical with a high deductible. And if an owner picks up half the cost of this, it's only going to cost each employee $10.50 per week. And this is where we're going to make our money big time, including dental. Dental's not being affected so far by Obamacare, but can you afford $39 to $49 per month or $49.95 per month for the best dental HMO plan in the country? And in some states it's $39, some states it's $49. Family plans start at $89.95. It's got an application fee. But this dental plan is the best dental plan with the largest dental insurance carrier in the country. So in our association, we've contracted with these insurance carriers to provide these benefits through a membership in our association. No waiting periods, largest dental network, over 25 million customers on this plan. Also, look at these sample copays. No cost for exams for the rest of your life. No cost for x-rays for the rest of your life for you, your family, and your children. Office visits as low as $5. And you can see all these low copays. It's incredible. This is the best and the lowest copays of any dental insurance plan in the country. You will not find a better plan. That's just an example. We'll get back with you with more information. So thank you, God bless, and welcome to KLM Healthcare.